afternoon, everyone, and welcome to today's edition of Black Health Trust. We are, as always, so happy that you chose to spend this time with us, and I don't think you're going to regret that decision today, as we are going to have a very vigorous conversation about the public health policies currently in development or announced in this country. Without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Thank you very much, Dr. Neighbor Stevens. Hello, Dr. Walks and Dr. Lawson. And I welcome Dr. Georges Benjamin and Dr. Napoleon Higgins. And I'm very, one thing, this is Dr. Higgins. Dr. Higgins, can you sign in the Black Health Trust?
Yeah, is the link on my email or?
Email.
Okay, sorry, I completely forgot.
Okay. So we have our guest today, and I'm wondering, Simon, if you can show the opening statement I wrote. I may need your help, Dr. Neighbor Stevens or Dr. Walks, in reading this statement. If you don't mind, I'll take credit for it, though. Yeah, I definitely help read it. I have eyesight problems. Got to make it bigger. Dr. Walks, will you take a crack at that?
Can you make it bigger? Okay, great.
I'm happy to take a crack at it, Dr. Maxey. Opening statement for panel discussion. Topic is U.S. federal government health policy a form of eugenics? Good evening, distinguished colleagues, physicians, psychiatrists, and health leaders. We gather today not simply to examine health policy, but to interrogate it. The question before us is stark, provocative, and deeply necessary. Is current U.S. federal government health policy functioning intentionally or not as a form of modern day eugenics, particularly in its impact on Black and other communities of color? To even pose this question requires courage, clarity, and the willingness to revisit both historical trauma and present-day injustice. Let us be clear. Black bodies, since the time of the Middle Passage, have been subject to commodification, exploitation, and experimentation. The transatlantic slave trade was not just a historical atrocity, it was a biological and physiological assault that encoded trauma in our physiology, our cortisol levels, our epigenetics. Our ancestors endured unspeakable violence, nutritional deprivation, forced breeding, and psychological terror. That legacy is not buried in the past. It is expressed today in elevated rates of hypertension, kidney failure, preterm birth, diabetes, and even increased vulnerability to chronic pain and substance use disorders. But the most insidious violence is policy violence. When a federal health system consistently underfunds Black-serving hospitals, criminalizes addiction over treating it, restricts pain medication access while ignoring pain, or withdraws support from Medicaid and mental health programs, this is not a passive oversight, it is structural neglect. When our people are denied life-extending medications, blocked from transplant lists due to outdated race-based GFR formulas, and when public health investments prioritize enforcement over empowerment, we must ask, is this healthcare or is it population control? Okay, and that is a statement read on behalf of Dr. Maxey to get our discussion started. So Dr. Maxey, how would you like to start our discussion?
I'd like to start, I just heard from Dr. Higgins, he's going to be signing on in a minute. But I've read a number of papers that have discussed this issue over the past several weeks. But if in fact, you know that the physiology of a group of people makes them vulnerable to certain issues, and your public health problems put them at more risk, is that a form of eugenics? And we know that eugenics originally started around the area of President Coolidge Calvin Coolidge. And we also know that one of the first people to write extensively about it was Charles Darwin. But we often think of eugenics as something that's done by war or by that type of thing, but can also be done by science. And I want to discuss that if you know that people are vulnerable to something and your policies make them more at risk, is that a form of targeted eugenics? We have with us as guests today Dr. George Benjamin, who is the president of the American Health Association, physician and long-term friend of mine and a national expert and treasurer. We also have Dr. William Lawson, psychiatrist, former president of the National Black Psychiatrists, and the current president of the Black Psychiatrists, Dr. Napoleon Higgins. And our panel, of course, and we would like Dr. Benjamin to open up with comments, discussing this somewhere around 10 minutes or so. I'm going to add the other speakers as we speak. Dr. Benjamin, the floor is yours.
Thank you, Dr. Maxey. One of the challenges we've had with this particular administration, as the Trump administration has come in, is that they have, in a very rapid period of time, began to do what's called the flood the zone strategy. And that is, they're doing a lot of very rapid policy changes that conservative members of our society have been trying to put in place for a long time. I think the challenge we have, though, is that they have really undermined both our economic security. We now are seeing a serious undermining of the existing really strong economy we had that the Biden administration left us with. They are undermining our national security through undermining a range of policies around the military, our place in the world in terms of security. And then, of course, they're undermining our health security, which I think the purpose of our conversation today. And they've done that through a variety of ways, basically by trying to take apart at the national level the health infrastructure that guides us all, that puts us in place a system to provide healthcare services, funds health, both throughout the public health and the healthcare part of the world. They have, for all practical purposes, tried to take apart the Department of Health and Human Services with a decision to cut abruptly about 24% of the funding coming out of that almost $2 trillion agency. I have to point out, of course, that people are policy. And while there have been several people that have been put in place that certainly are not qualified for many of the jobs that they have, and my belief is the most egregious one is, of course, the individual they put in charge of the U.S. Department of Health and Human Services, Mr. Robert F. Kennedy, who was a lawyer, does not have a health background, has never run any kind of complex organization, and has some real challenges, both in the way he thinks about health, and of course, we know he is a long-term vaccine denier. And so if we think about the health of America, let me just say there's several things. Number one, I always talk about the fact that when you get one of these new big health jobs, your governor or mayor, or in this case, the president has his agenda. And when you take this job, may have some things that you think are important to put on your agenda. But when you get into these jobs, you have to realize that there is an enormous existing agenda on the table. Mm-hmm. So in the United States, for example, we spend almost $5 trillion a year on healthcare. And yet, when compared to all the other industrialized nations in the world, we're at the bottom. How is that? When we have such amazing technology, we train people very well. We have some of the best clinicians on the planet here in the United States. But the reason is because we haven't dealt with the fundamentals. For example, we're the only industrialized nation that doesn't have a system with everyone in and nobody out. I'm not talking about single payer per se. I am talking about the fact that we're the only nation in the world which doesn't guarantee health coverage as a fundamental human right for all of the citizens. Secondly, we underemphasize primary care when compared to all the other industrialized nations. We underinvest in primary care. We pay primary care clinicians much less than we pay our highly paid specialists. Not to take anything away from our highly paid specialists. They're great, they're wonderful, that you get paid for what they do. But we underinvest in primary care. And we really undervalue it in many ways. Thirdly, we have a fractured healthcare system. As you know, both in the payment side as well as the delivery side, it's much more fractionated than compared to the other industrialized nations. And then finally, we severely underinvest in the social determinants of health. These are the things that in society empower you to be healthy, or can serve as a barrier. So, for example, we know that if a woman gets educated, that her child is much more likely to survive their first year of life. Every society that's looked at infant mortality there's been a correlation between the education of the mom and the survival of the baby. Now, there's a lot of reasons for that, and education serves as a surrogate for a lot of things. But also note that high school graduation, regardless of gender, serves as a strong determinant about how well you do. And we also know that economics, the more money you have, the better you do, quite frankly. That makes sense, right? We know there's a strong correlation between economics, a strong correlation between access to transportation, access to safe, affordable foods, access to safe housing. All those things make a big difference. And so nations that have had universal childcare, universal long-term care, that invest in the social determinants of health in their communities, they do better. And they actually spend much less money than we do for health. So in our nation, we've had dramatic improvements in life expectancy. Now, COVID took us for a loop. We had marked reductions in life expectancy during COVID. But post-COVID, most of that's returned. We've not returned back to our pre-COVID life expectancy levels. But we also know that during COVID, something that we've known for years became more prevalent, more obvious to everybody. And that's the health inequities in our country. That communities of color, particularly African-American and Hispanic individuals, are much more likely to have more heart disease, more lung disease, more kidney disease when compared to non-Hispanic whites. And while there has been improvements in longevity for all populations, those gaps have remained. Now, many of the things that this administration is doing is going to exacerbate those gaps. So, for example, the fact that they are taking away most of the policy programs and the prevention programs at the U.S. Center for Disease Control and Prevention. They just basically zeroed them out. And they zeroed out the ones that take care of heart disease, lung disease, kidney disease, lead exposure. Those programs are about to go away because the administration is trying to make them go away. This, what they call the Big Beautiful Bill, is going to cut the Medicaid program by almost $800 billion over 10 years. But let me tell you what that means. That means that more people will be put on the street because the intent, they will say that we're not cutting people, they're just making sure everybody goes to work. When the Affordable Care Act was passed many years ago, Medicaid was transformed from a welfare program to an insurance program. So it's now an insurance program, just like Blue Cross Blue Shield. And in fact, all the private insurers now cover the Medicaid program. In fact, a lot of people don't know they have Medicaid because the card they have is from a private insurer, but it's funded through your tax dollars through the Medicaid program. And almost everybody on the Medicaid program already works or has a disability and has some reason why they couldn't work, but most people do work. So this idea of putting a work reporting requirement, because that's what it is. It's not really a work requirement. It's a requirement that you report work so that if you miss a piece of paper if you don't show up at a particular time, you get kicked off the program. And so the real goal is to kick people off the program to save money. And they have a long experience with this. So we know exactly how many people are going to lose coverage when they do that. The other thing that they're doing with that bill is they are, during COVID, they expanded the federal subsidies for those of you who are not in Medicaid, but who get your care through the health exchanges. Those subsidies are going to go away at the end of the year, and they cut those. That means that your premiums are all going to go up. And even if you don't see yourself in the Medicaid program or you're in the health exchange and you have private insurance, nothing's free. So that means that even if you have private insurance, employer-based insurance, your costs are going to go up because it creates uncompensated care. And for communities of color, where you have hospitals that are already on the edge, that means more hospitals will close. And if you live in a rural community, we'll see a whole bunch of closures of rural hospitals. So that's what they're planning for us. And by the way, the reason they're doing that is to give the very wealthy a tax cut. So they are, doing things like giving people a tax break for tanning beds, but taking away hospital beds for people. It's the most bizarre thing I've ever seen. And so that's being debated right now in the Senate. And we can talk about what one needs to do about that. But my point was, as they're looking at funding, they're taking apart the systems, they're cutting the money, and they're putting in place all kinds of policies that are anti-public health, which will disproportionately impact communities of color. And we need to pay attention. We need to wake up, and we need to engage aggressively with our elected officials and tell them we're not going to tolerate this. With that, I'm going to stop, and I'll turn it back over to Dr. Maxson.
Dr. Maxson, you're muted.
Can you hear me now?
Yeah.
Dr. Bennett, I thank you so much for your talk, and we're going to ask people to hold questions for just a moment till we get the other panelists in, but you've been my hero for years and years, and you remain so. Is Dr. Higgins on yet?
Yes.
Yes, I'm on. Can you hear me?
Yes, sir. Dr. Napoleon Higgins is a famous psychiatrist. He's president of the Black Psychiatrists of America, and he's agreed to be on with us today, along with Dr. Lawson and Dr. George Benjamin. We've been talking about, is the current U.S. health policy a form of eugenics, given the fact that we know that since people of color came to these shores and came across the Middle Passage, that they've had issues with their health, with their cortisol levels, with their psychiatric problems, with their health problems, blood pressure, stroke, high blood pressure, is the fact that our health policy is aimed at taking away the services that help our patients get their care, is a form of eugenics. Dr. Napoleon, and if you speak for the next 10 or so minutes and be on the panel, we sure would appreciate it. And glad you could join us representing the Psychiatrists of America, including Dr. Walks.
Thank you all so much for allowing me to be able to be here and speak. I would say that the simple answer is yes. I mean, the policies that we're talking about have, been a detriment to us. We've always been under a system of a scope of oppression when it comes to our both mental and our physical health, to create a state of, physical disorder, but also a state of confusion in our minds. So the fact is, when you look at eugenics and the lies that have been told about people and race and who is the same and who is not, essentially two black people are the same versus a black person versus a white person is somebody different. And then you're looking at the splitting of people's minds to make them believe that one color is different than another. I tell people it's like looking at two Labrador retrievers. One's a golden lab, one's a black lab. You say, well, obviously the black lab must be slow or stupid, and the golden lab must be a much different type of dog. and must be very smart and intelligent simply because its canine color is golden versus one is black. Well, obviously, dogs don't do that. They don't differentiate themselves in that manner. And the fact that is that humans somehow have bought into this, and this has been sold over a period of years since we created the idea of eugenics, that one race is better than the other. So when we look at this and the use of the resources to convince people that these people should not have while these people do have, it's something that America has bought into. One, the globe is bought into it, but America has a special way of buy-in that impacts us as people. Now, the other part of that is people don't quite realize that it affects a lot of other people. So eugenics is based upon that Northern Europeans are smarter than all other Europeans, and then next to that would be Asians, and then last to that we would be blacks. With the buy-in that people are willing to do in order to defend this system of oppression, is that they're willing to be oppressed as well, as long as they can feel as if they are different. I know that during my time at Meharry, doing a rotation out in East Tennessee, I had never seen that level of poverty in America before, where people were that poor. And I know people who grew up in the hood, and I lived next to the hood. I didn't well, I did grow up in the hood. I didn't live in the ghetto, which is something different when it comes to level of poverty. But I never saw people without shoes in America, or who are without clothing, or who slept on dirt floors. And when it rained, you essentially had to lay in the mud. I did not know that that part of America exists, but it does. The craziness is that people are willing to vote against their own interests based upon eugenics so that I can feel as if I'm better than another person, regardless if my financial situation is the same. Well, what we see now is this doubling down on this sort, where it becomes the blacks, it becomes the Latinos, it becomes people from other countries who we need to get rid of, that we need to keep out, and things of that sort. And so, with that buy-in, you have this continual perpetuation, or well, back a better word, you have this continual run on that we continue to fall into. So this is going to continue to hurt people of color, but it's going to also hurt the others who fall within eugenics, is if, because not all whites are, not all Europeans are from Northern Europe. All right. So the less you are, and when you look at eugenics, you're looking at distance. So you have the northeastern upper middle class to rich white person who's going to do the best under this situation. But as you spread throughout America, it's going to hit, obviously, the biggest hit will be of people of color and black people, but it's going to hit all ranges in between. And until we can wake up as a country and understand that this whole race issue, a class issue, is something that is going to continue to hurt us, as long as we buy into it, I don't know what else we could do. So far as a country. So far as black people, I remember having a conversation with my dad. He's 86 years of age, grew up in rural Texas in the 1930s. And when we looking at some of these issues, he said, well, maybe black people can get back to what we used to do, which is depending upon one another, and not so much depending upon the state to do what they're going to do, but what can we do for ourselves? Realizing that black people's health in America has not always been the worst health. In the 1940s and 50s, during the worst of our discriminations, and of course, we had to worry about lynchings and things of that sort back then, that was actually when we were at our best health, when we were not necessarily inside of the American systems, and that we lived longer in the 1950s and the 1970s than we do now in comparison to the rest of America. So, with all these gains that we've made, what we've lost is a sense of ourselves and depending upon ourselves, so far as buying food from our places, buying food from other farmers, or trading and things of that sort of, and bartering amongst ourselves. When we did that, we lived healthier. So I would say the way out of this, one, we got to vote. All right. We can't be complaining just on the phone and calls. We've got to vote. We got to push the people around us to vote. But also, we have to look at our own interdependence amongst ourselves inside of our own institutions so that we can improve ourselves and stop waiting. And definitely, we can't wait on this administration to help us out.
Well, thank you so much, Dr. Higgins. We're going to have the panel in just one more. Have one more speaker I'd like to hear from. Is Dr. Lawson on?
He
Dr.
is.
Lawson is here.
Hello, Dr. Lawson. Welcome. You're my other hero. This is the day of my heroes are all on the Black Health Trust. Dr. Lawson is a very well-known MD, PhD psychiatrist, and he has a PhD in, is it pharmacology?
Psychology.
Psychology. and he's been our co-moderator for months on the Black Health Trust. I'd like your opinion on, is the current health system and health policy a form of targeted eugenics?
I think that being last in this illustrious group, um, I'm just amazed at how much we agree with each other, but also gives a common perspective in terms of what's going on. Let's just go back to the old concept of eugenics. Eugenics is the idea that you could improve the human race by weeding out the inferior beings and keeping the superior beings and so forth. But when you look at the situation of African Americans in the U.S., we have a very interesting phenomena. And that is, if you look historically, we had a system in which we had a group that were victims of charter slavery. They were not, the idea was not to try to kill them off, but the idea was to make them do what was beneficial to the white population. That is, to create a group of people did not use their brains, were physically strong, had short lifespans, and that led to a very effective economic system, at least for the white folks involved. Now, the problem, and some people know, Adolf Hitler looked at the system, liked it. He took out part of it. He decided to kill off the folks rather than keep them around for labor. But we continue to perpetuate that system. And the system right now is based on the same idea. I just finished a stint as the president of the senior psychiatrist and noted that one of the problems has been that when you look at our elderly, the idea is that for a long time, the life expectancy of African Americans was such that we never made it to the point where we could benefit from retirement, Medicaid, Medicare, all that recent stuff. And is this done deliberately? Well, it certainly does benefit the larger system. The insurance companies and others save money because you don't have to pay out funding for folks when they get elderly because they're gone, especially African Americans, and that leaves more money for everybody else. The other component of that has already been emphasized also is that it reinforces the need to perpetuate disparities. And that is that if you don't provide a lot of resources for chronic diseases and make sure that people don't live a long time, then it becomes economically viable and you continue to have a system in which you have more money for those who are, quotes, outside the group rather than those at the end. And we're also stating this as if it's an inevitability when in fact it is not. The system is implied is that it was designed to be that way. And that is that there would be one group that would have less resources, less access to care, less education. And the result is that that group, while early on they may be somewhat costly, in the long run, they'll be gone for people later in life. And then there's the question about are things getting better or worse. I think Dr. Higgins stated very well that it's waxed and waned for African Americans. We still not have the kind of resources that we'd like to have in our community in terms of specialty care, research that's demonstrating what's more effective for African Americans. The kind of money that's spent for disorders such as sickle cell is terrible compared to money spent for disorders that are common in the white community. So we have a system that perpetuates the idea of getting limited resources that would change the system. And in addition, you talked already about the educational issue, but another component of the education issue is that there's never been a strong interest in terms of getting greater specialized care. Never been African Americans in the physicians and nurses and psychologists as needed. There was also, as Dr. Benjamin noted, the importance of psychosocial behavioral health. The big killers in our community often is homicide, suicide, drug overdose. And yet our system has worked against addressing those issues. We pretend that suicide doesn't exist in the African American community, drug overdose, is encouraged by the use of failure to focus on treatment for drug abuse, and is much more of a punitive system, which, if anything, tends to reinforce drug abuse. And of course, there have been several times with legislators that tried to block attempts to look at gun violence, to research into gun violence as a source of killing in terms of our community. So I agree with both speakers. One place we can start looking at is our own community. I just saw a note, someone saying, we got to look at food deserts. It's very interesting. One of the wealthiest counties in the country in terms of African American, PG County, went out there and tried to find a grocery store, couldn't find one. Many of our communities don't have grocery stores. What in the world is that about? And yet we're talking about, well, okay, we can build farms. What kind of farms are we going to build? Marijuana farms. But not in terms of getting farms where people can feed each other in terms of our community. So and so that kind of thinking is encouraged as part of the overall concept. I think a big step would be for folks to do a hard look at how is our behavior directed towards improving the outcomes of our citizens, or is directed towards perpetuating a previous system. And of course, and even if you bring in infinite amounts of money, the bottom line is if folks do not recognize that their behavior is leading to a poor outcome, they're going to continue to do the same thing over and over again. So we have some answers. Many of us have talked about what can be done. It won't be simply just going out and voting the rascals out. It's much more of changing the mindset of the country and the zeitgeist in which it's working in terms of what in fact do we really want to do. Do we want to save a selected few people of one ethnicity, or do we want to provide health care so that we have some positives for all folks?
And thank you so much, Dr. Lawson. As we start the discussion, I'm going to ask the discussion to be started off with Dr. Walks, who's also a past director of public health for the city of Washington, D.C. But an observation that I've made that was disturbing to me, I read a paper by Dr. Matthews, who wrote about the problems in Australia. And he wrote that the way they manage the Aboriginals is almost like animal husbandry, that you can treat a certain population like animals and breed a dog with 2 spots versus 3 spots. And I believe that that may be some of what's going on here. But in response to our speakers and starting to question them, Dr. Walsh, would you lead that off?
Dr. Maxey, now that I've both been angered and depressed by the amazing, accurate content of our presenters, this is a very challenging area for us, critically important, obviously, for all the reasons that have been shared today, but not really simple. A lot of it has to do with how we, as people that look like us, are valued. And if we're not valued by either our own communities or by the policies that are coming out of the current administration, because what we're talking about is in part kind of how we got here and where we are. And at the same time, we're talking about what's going on now that can wind up making our situation worse and prevent us from pulling ourselves up and out of where we are. So let me say this about that. We are not 70% of the population of the United States of America. And so when we look at nationwide policies, it's challenging to expect that those policies are going to be directed toward us in a very positive way. Having said that, other communities that don't have a majority of the population have been able to do that. And I think it was Dr. Higgins who made the initial comment about us needing to vote. We need to not only vote, we need to organize. We need to be very clear about what it is that we are voting for and we will vote for and who we think is going to do things in our communities. We do have African Americans who are mayors, who are county executives. We have one African American governor. We have a lot of opportunity to look at people that look like us and begin to ask them to put local policies in place that would help us from a health perspective. Now, having said that, it's hard to get elected officials to put dollars in places where they can't see a return on that investment. So it means that we are going to have to, if we're going to build grocery stores in certain communities, Dr. Lawson talked about the need for additional grocery opportunities in places like Prince George's County and other places. We need to make sure that we are going to frequent those places, that we are going to not have them looking like, I don't know anybody else, if anybody else has been to the Giant supermarket on Alabama Avenue in Washington, D.C. Don't laugh, Dr. Lawson. You know what I'm going to say. That is a supermarket in our community, and you walk in there and it's like I don't know. I think there are more security people in there and more stuff locked down than there are opportunities to buy produce. And so I think a
What
lot
street
of
is it on?
what's that?
What street did you say it's on?
Alabama.
Alabama.
Alabama Avenue.
Yes.
Thank you.
So, I mean, look, we can find examples all over the country about places where we as as people can help our young people to be more empowered and to do better. We can come together, as was said earlier, in our communities. I'm not trying to wait on Donald Trump and whoever else is working with him to help me. I think that is a fool's errand. I think we really do have to acknowledge what they're doing is not healthy for us, and we have to try to set examples for anybody who wants to work with us that we can lift up and hold up our end. So I'll stop there.
And thank you. Dr. Barbara Neighbor Stevens, pediatrician from Nashville, Tennessee.
Thank you. Thank you to our panelists, and I'm so happy that we are having this conversation. I am a product of Memphis, Tennessee, and my perspective naturally has been I won't say created, but certainly affected by what I experienced growing up. And you may have heard of this young man. He's part of the so-called Tennessee Three. State Senator Justin Jones
Yes.
was on Belchy this morning. And he ended his little piece. He, as Velchi said, you gave us our shot of B12 for the day because he had the energy, he had the insight, and he had the message. And his message was, yes, we do need to vote. And I certainly am not in any way disparaging the notion of voting, but there's so much more that we not need to do, but have to do. His closing comments were resistance. And we don't like to talk about resistance much now. Maybe it's not a particularly safe thing to talk about now. But again, when I grew up, we resisted. And I think that we need to, we have this saying, pussyfooting. We don't need to pussyfoot around all of this. We need to figure out what we want and how we're gonna get it. My question to the panelists in response to those comments is specifically and practically, what can we identify as takeaways from today besides the general statement we need to vote?
Dr. Benjamin.
Yeah, well, let me add. I think they are totally restructuring the economic foundations of our nation right now. That House bill that the Senate is debating will make it almost impossible to build strong health programs in the future. So it must not go through. So the first thing I think everybody ought to do is talk to their members, their senators. That's a phone call, that's a letter saying don't support this bill. Talk about the Medicaid cuts, talk about the cuts to the health programs. And you know what? It's not a big deal. You just make a phone call. They count the number of calls they get. Everybody has 2 senators, and don't do it just for the Republican ones. Do it for Democrats too, because you want to make sure that you are getting support from both sides of the political aisle in our country. That's the first thing I think people ought to do. I think the second thing is don't do obligatory compliance. Obligatory compliance is where they say something that may be illegal, and you say, okay, I'm going to do it. Don't do that. One of the things that we are all doing right now, not us on this call probably, but every academic center, business that is running like away from diversity, equity, and inclusion, as though DEI is somehow discriminatory. It is not. We are allowing them to redefine it. Do not let them do that. Diversity means just what it means, right? We want everybody to have an opportunity for optimal health. Inclusion means asking who's not in the room and who do we need to bring to the table so their voice gets heard. And the goal, of course, is to make sure we have, again, equitable outcomes. And we need to not let them redefine DEI. We need to say no, period. I think if we did those 2 things to start, that would be a great start. And then, obviously, every other elected official, school board, homeowners association, mayors, governors, we ought to make sure they get the same message. But start with the folks in the Senate, because right now they're about to destroy the economic framework of this country.
Thank you. Dr. Higgins, especially from the psychological, psychiatric side of this, how would you answer those questions?
Well, my first response would be whatever Dr. Lawson said. But beyond that, I would prefer to go after him versus before. But so he can give me some ideas. The tangible thing is one, making sure that you do what you can. So, I'm going to reemphasize voting because that matters because people in power want to stay in power. And there's 2 things that comes with the vote. One, letting your voice be known, be it for what they're trying to do, or let it be known that you voted against what it is, because they want to stay in that power. But 2, it does matter calling your national person, be it your senator, your governor's office, but also don't forget about your local state representatives and your city councils and your county people as well, because a lot of those decisions they may be made higher up, but the disbursement and how it's going to be implemented many times is done by local people that you know. So calling them and then showing up to these different town halls. People learn and have to wake up when they see it right in front of them. So all of those things matter. But also the thought of knowing and understanding, trying to find a group of people who are going to be self-reliant in the work that they do. So far as especially with our finances and our movement of money inside of the Black community. We want to try to do that as often and as much as we can, and not look for those outside resources. So far as with our mental health, I would tell people if you are not stressed as a Black person, then I don't know what's wrong with you. All right. So essentially, you do need to take advantage of the resources that you have. So far as if you're overly stressed or overly worried, because I'm seeing that in my office and clinic of people of all Black people of all sorts, be it those with money, those who have power, those who are upper middle class, those who are doctors, those who are electricians, and those who are water workers, to those who don't have a job. Everybody is stressed out right now, and it's important to make sure you take care of your mental health and access the resources that you may have, even if it takes a while. Also, just to mention, 988 is a phone number that if you don't know what to do, or if other people don't know what to do, even in your primary care offices, that 988 phone number, there's a recent study that showed that it was something crazy number, like over 90% of the people who call with suicidal thoughts feel like just calling that number and talking to a professional on the other side of that phone saved their lives. over 90% felt like it saved their life. So I would recommend that we as clinicians, as doctors, we should have that phone number up all the time inside of our office. That needs to be everywhere so that people know how to access that resource. Also, the things that you can do, trying to take care of for your mental health. And oddly enough, whatever helps your mind also helps your heart. It helps acne. It helps whatever on your body, which is trying to get plenty of sleep. All right, despite what's going on, make sure that you eat well, eat healthy. I found that there are certain things that I cannot eat that America serves, and we're down to hunter gatherers at this point. So essentially the good foods for us are not actively available. So sleep what you eat, make sure you exercise, physically exercise, make sure you get good air, good water, the good nutrition. Make sure that you can find a place where you can let your hair down and let loose, be it at your church, your barbershop, your fraternity, links, other organizations, whatever groups that you could find release in, trying to find good people, trying to talk about positive things, talk about the current issues that we have going on today. But as we're talking about today, what can we do about it? These are some of the things that we can do as individuals in this uncertain time that can actually help us even during these periods of stress that we're going through right now.
No, thank you, Dr. Higgins. Dr. Barbara Davis Stevens made a statement that I totally agree with. We talk about eating right, we talk about exercise and doing cardio exercise, but rarely do we talk about resistance exercise. And resistance exercise is just as important as the cardio exercise. But all of us on this call do belong to an organization called the National Medical Association. I'm wondering if we go around the horn, is there anything that we as the Black Doctors of America can do collectively? And we got a convention coming up in Chicago next month. I'd like to comment on all of us. What is it that we should shoot for there? How can we get in a plenary session? How can we move that organization to our benefit on the issues of contravening this eugenics effort here?
Well, if you don't mind, I'd like to bring in the point that one thing that the organization does, by the way, that no other medical group in this country does, is to bring together 20 plus specialties. I don't know that much currently in terms of what's happening for thoracic surgery. I'm sure that a lot of folks in thoracic surgery don't know what's happening in psychiatry. But in a meeting like that, we can share that information. One of the consequences, I think, of the fact that many of us have large volumes of patients in areas in which we usually don't have a lot of backup help, it's hard to keep up with the field and to get the information out that's necessary. And I've talked to a number of providers, talked to my dentist recently, saying, you got a lot of great information. Not only do you want to have it for yourself, you want to have it for your colleague, and you want to have it for the community. So all of us need to be in charge of teaching and in and promoting information to our patients and being receptive. I've had too many patients who come in and say, and I guess then for a minute, for some of us, it's this tendency to become defensive when patients start asking too many questions about why I take this treatment or that treatment. If you have 10 minutes to do a thorough evaluation and treat the patient, you want to get them in and get them out as fast as you can. But at the same time, it's important to explain, provide information. There's multiple studies showing, especially in our community, that too many of our folks aren't receptive to patients trying to find out more information about why they're getting that specific treatment and whether that should be the best treatment. We need to do more to be receptive to the knowledge needs, not only of our patients, but our communities. And it doesn't have to be through a medical center or a mental health center. There are several programs that are using barbershops, that are using beauty parlors to be able to spread the information. And also, one of the enduring institutions that's existed in our community has been the Black church. The church should not be an enemy of getting information out to our community. Religion should not be looked at as countervailant to medical information, working collaboratively with the church and the faith community has been shown to be very effective. Multiple studies have shown that when you're working in collaboration, you can get better outcomes. We talked about the whole DEI issue. One of the points is not just that DEI is useful, but that it has a positive outcome. For people who have DEI knowledge have better outcomes in terms of patients. They have better outcomes in terms of what are the effects in terms of their community. So part of it, I think, extremely important is educating ourselves, our community, using our indigenous institutions, and also being at the point at which decisions are being made. It is not just, as Dr. Higgins stated very well, not just, and this is again, I think this is a reflection of slavery that you had the white master who has all the information, and that and depend on them to bring the resources. But it's also looking at these smaller institutions, these smaller organizations, making sure you're at the committee meetings, local areas, to be able to make input in terms of decision making in our communities.
Well, I thank you so much. I really appreciate our panel bringing this information. We're at the top of our hour. I want to make sure that we don't impede too much on people's time, but I'd like to have final comments that our panel may want to make and our moderators, since we're at the top of our hour. And I certainly appreciate this wonderful information that you brought to the table. Starting off with Dr. Benjamin, you were first. Any final parting comments you would make on our subject?
Yeah, our health is in our own hands. We have an opportunity to take control of our own health, and we should do that.
Thank you. Dr. Higgins.
It's great to be a part of this panel. Always enjoy Black Health Trust. We've already said what needs to be done. It's a matter of implementing it and taking it further from this conversation. So thank you all for allowing me to be here.
Okay. And Dr. Lawson?
Just repeat what I just said. As Dr. Walks noted very well, let's take and Dr. Higgins, let's take what's happening in this forum and create more of them so that we can inform our community and our providers.
Thank you. Dr. Ivan Walks.
Thank you, Dr. Maxley. Thank you, Dr. Higgins. Thank you, Dr. Lawson. Thank you, Dr. Benjamin. Dr. Benjamin, we got to have breakfast again soon. It's been at least a couple of weeks. I want to point out that unless the picture is about 40 years old, I really want to thank Dr. Lawson for inviting Daryl Bennett to join us today. Because I remember when I used to look like that. He looks young and full of energy. He looks positive. And I think that we have to be able to encourage people across the decades to come together and mix all that gray hair wisdom with some of that not gray hair enthusiasm and make things happen and make things move in our community. I think that in Dr. there he is, still looking young. I don't like you. Don't look that young. No, listen. Thank you, Dr. Lawson, for bringing that young man with us, because we need to work together. We need to work collectively. And I think that eugenics, let me say this, Dr. Maxey, eugenics tends to be a purposeful thing that folks do because they have a goal. What you wrote in your early comment, Dr. Maxey, was you put this question in, is it targeted or is it neglect? I'm going to assume, because, I went to church this morning, that it's just neglect and they're not trying to kill us. And I'm going to submit that it doesn't matter which one it is. I think that we have to prepare for what's coming. I think Dr. Benjamin started us off by laying it out absolutely clearly what is coming our way. And if we ignore that, we ignore it to our peril. If we ignore Dr. Higgins' comments about how we need to do our links in our fraternities and our church and our barbershop, someplace where we can unwind and be around people who are going to encourage us and who want us to be there. So many, Dr. Benjamin, how many meetings have you and I been in when they didn't really want us to be there?
We were the only ones in the room.
Right.
We looked like us.
We need to be places where they want us to be, with people who want to be with us. And so I just want to make sure that we do encourage each other, support each other, and not care whether they're trying to hurt us or they're just hurting us. But if you're hitting me upside the head, I need to deal with the fact that I'm getting hit upside the head. I'm not worried about your motivation. I'm not worried about whether you accidentally punch me in the face. I need to stop getting my face punched. Thank you, Dr. Maxon.
You're welcome. Dr. Barbara Neighbor Stevens.
Well, I am enthused by our conversation. I am motivated, and I have some, you asked the question about what we can try to do at NMA. I think the groundwork was laid at the colloquium. I hope you would agree, Dr. Benjamin. And I think we need to just move forward on the groundwork that was laid. And all of us, whether we're in NMA or in our homes, find that opportunity and move on it to take control of the situation.
Amen.
Well, thank everybody for spending their Sunday afternoon with us, and it's been a great discussion. Thank you, Dr. Benjamin. Thank you, Dr. Lawson. Thank you, Dr. Napoleon Higgins, and thank you, Dr. Walsh and Dr. Neighbor Stevens, and thank you, Simon. Have a great, great Sunday. Have a good day. I happen to be in Florida, the sunny state. I'm going back to California today. Have a great day.
All right, thank
Safe
you all.
Good day,
travels.
everyone.
Bye-bye.